Jonathan, we're being told the big one is still to come.
Andrea, good morning to you. Yes, it's sobering and alarming to think that for a virus which has now killed almost 1.8 million people, that the big one is still out there. But that's exactly what the World Health Organization is telling us today. Its last press conference for the year in 12 months since it first learned about this deadly new strain of pneumonia originating out of Wuhan in China. The World Health Organization has congratulated the world on its fast-paced response. It's also made the point, though, that a number of smaller, poorer countries have dealt with this far quicker and smarter than many of our wealthier nations. Read into that the United Kingdom and the United States, both of which have struggled with containing COVID-19. It does make the point, though, that we need to be prepared for something far more severe emerging on the horizon.
And I will say one thing, and it may come as a shock to people. This pandemic has been very severe. It's spread around the world extremely quickly. It has affected every corner of this planet. But this is not necessarily the big one. This virus is very transmissible, and it kills people, and it has deprived so many people of loved ones. But its current case fatality is reasonably low in comparison to other emerging diseases. This is a wake-up call. If there's one thing we need to take from this pandemic, with all of the tragedy and loss, is that we need to get our act together. We need to get ready for something that may even be more severe in future.
Yeah, Andrea, we're all obviously putting our stocks in a vaccine, but the World Health Organization has made the point that even those who are vaccinated could still potentially spread the virus going forward. So it means that we're likely, obviously, to see this pandemic remain endemic within our society, and we won't be removing it completely. They make the point that we still need to be vigilant.
The existence of a vaccine, even at high efficacy, is no guarantee of eliminating or eradicating an infectious disease. That is a very high bar for us to be able to get over. First and foremost, we have to focus on saving lives, getting good control on this epidemic so our societies can return to normal, and then we will deal with the moonshot of potentially being able to eliminate or eradicate this virus. But at this point, based on the tools we have and the knowledge we have, that's impossible to say.
Yeah, the moonshot there, Andrea, talking about removing this virus altogether. Of course, if people still are contagious returning to the country, that will mean we're likely to see quarantine measures remain in place for a long time yet. Andrea.
Seems that way, definitely. Jonathan Lee, thank you in Canberra.